All right, shoulder injuries. So common injuries of the shoulder. Remember, first things first, the shoulder complex, because it is so highly movable, it is susceptible to a lot of different injuries. It's external, it's on the outside, it's prone for location, as well as because it has high mobility. Remember, go back, the higher the mobility, the more chance of injury. So fractures, dislocation, subluxation, tendonitis, impingement, strains, sprains, name it, it can happen. Clavicle fracture, super common, the most common fractured bone in the shoulder complex. Literally, it is from a fall or direct blow. To be honest, I had one the other night at practice. It's very common and it's very obvious. Most oftenly, it's the middle third and it pops right out. You can see it. It is not hidden at all. You can feel it. A lot of times you can feel even the sharp edge of the bone through the skin. If it is posteriorly, meaning instead of popped up like in these pictures it's describing, if it's pushed down, that is a medical emergency. There's too many nerves and arteries and those bone shards are sharp. So if it's popped up, yes, it's an emergency. Yes, get them to the emergent or ER urgent care to get the x-ray, but not devastating. The other one, much more severe, send them right away, possible 911 call depending on your situation. Also, you want to make sure they maintain circulation as well as sensation throughout their whole arm. Most oftenly, they're going to hold their arm to give it support to decrease the pain. So you can put them in a sling or with an ACE wrap to hold them up so that they don't have that pressure. Fractured scapula. This is pretty uncommon. I have seen it. This is from a direct blow. Most oftenly, it's from football and a helmet hits directly in that shoulder blade, or somehow the shoulder pad moves and it didn't protect it. Most oftenly, there's no deformity because think about it, there's a lot of muscles over that scapula. Also, it's a significant pain. So the few times I have seen this, it's the pain that is and the location of the pain, and they're unable to move their arm, but nothing looks quote unquote wrong with their shoulder. This is an MD referral. So this is a long recovery most often. This is quite a few weeks, if not months, in recovery. AC joints or a separated shoulder. I'm sure most of you have heard of a separated shoulder before. Honestly, it's like an AC sprain. It's equivalent to an ankle sprain of the shoulder. Now, our AC joint is our acromion-clavicular joint, remember? So it's where the clavicle attaches to the acromion part of the scapula. So this is where basically that ligament that attaches the two is stretched, torn, depending on degree. Typical mechanism is either a downward blow directly on the spot or foosh, meaning fall on an outstretched hand, basically falling straight out on your arm. Severity is determined on the degree of damage to the ligament, just like every other sprain. First degree, no significant. Second degree, partial tearing. Third degree, complete rupture. Most oftenly, there's mild swelling and point tenderness right on the AC, and any movement is painful. Most oftenly, also above 90 degrees, they can't get there. Sometimes with a third degree, you will see a snap or a pop and even some deformity. So you'll notice that their clavicle is much higher on that side, right at the joint, because that ligament holds the clavicle down right there. Sternoclavicular joint injuries. So these are less common compared to the AC or glenohumeral area, simply because it's closer to. There's also a lot more things in that area, so the structure of it is much more protected. The likelihood of you getting hit like in the bottom of the throat is pretty low. That's one of the reasons. You can also injure this at the same time you hurt your AC since they're connected, okay? So depending on what happens, it can definitely be affected. Now, most often it's an external blow to the shoulder, resulting in the clavicle movement anteriorly, most often anterior and superiorly. Once again, if this goes posteriorly or in, this is a medical emergency. You'll feel a deformity and there's pain with all shoulder movement right at the SC joint. Glenohumeral joint injuries or subluxations or dislocations. Everyone's probably heard of a shoulder dislocation. This is what it is. Typical mechanism is external rotation and abduction above 90 degrees. So that is where typically you're at the most risk and when it happens most often. think of in water polo, like someone slot machines or pull back their arm. That is the most common mechanism. It's also anterior dislocation can happen most oftenly. So meaning, if you look at those pictures there, anterior dislocation, the head of the humerus comes forward and a little bit down. So anterior dislocation is almost in their armpit. Posterior dislocation, it goes back. There's signs and deformity of, or signs of this is majorly deformity. So if you look at that picture of the guy, notice how his his right shoulder, it looks just like sunken or just a quarter, like right angle. That's his AC joint in essence. So he's lost the ball that projects his shoulder out. Okay, so normally there's like it goes just straight down, and if you start feeling around right at that top of the bicep right there, you almost feel the head of the humerus almost looking in their armpit. Also, the arm looks longer and is actually longer because it's hanging down. Technically, by rule, only a physician or an MD doctor can relocate a dislocation. Have I relocated shoulders? Absolutely. Is it recommended? No. It depends on the situation, and it depends on what happens after. Most oftenly, I will try to relocate it once or twice. If I get it, great, and then they go off to the doctor immediately. If I cannot get it in 1 or 2 tries, then I do not do it, and they're going to the ER, urgent care, with their shoulder out of place. The reason to do it is simply for comfort reasons. And depending on if it's a chronic dislocator, sometimes they can even do it themselves. It depends on the situation. So I want to show you this video.
So you got to play with them a couple minutes and see their games. Size them up.
Ganner takes a shot over the 7-footer, digs it off the floor. Both are on the deck, and they're going to jump it. Good hustle.
So look at his shoulder when that ref moves his leg right there. See how it's it's almost like a just bone looking. It didn't look muscular.
I mean, that's stuff you see on videos on YouTube. Well, you know what YouTube is? I gotta explain.
Yeah.
So notice, see how it is almost like a right angle there, like he doesn't have the musculature right there. His shoulder's out right now.
Oh yeah, you can tell.
So that's how you can tell is when you see that poking area right there. All right. See the angle right there? And do you see that guy kind of moving it and shaking it? He's trying to get it back into place without him noticing it. Notice when he gets it, it's when he's in full extension here. It's right there when he lands on it. Remember that external rotation, abduction, when you're at above 90 degrees.
What happens now, you pop that back in, but he might have to miss some time now. Guys.
So muscle strains. So obviously there's a lot of muscles in the shoulder, so you can obviously strain them. There's a dynamic overload from excessive range of motion because your shoulder can move in so many directions. Most common injury is the quote-unquote rotator cuff strain. Remember, there's 4 muscles that make up the rotator cuff. This is due to errors in execution of a throw or a swing of an overuse injury. Point tenderness around the deep humeral head that almost seems like super deep into the deltoid. And pain and stiffness 12 to 24 hours after are the most common complaints. Impingement syndrome. Impingement syndrome, super common, happens in pretty much all overhead athletes. Anyone that has a constant overhead movement, throwing athletes, swimming athletes, anything that's overhead. This is basically when the bursa or the tendon is squeezed between 2 structures. So there's a couple different locations impingement can happen within the shoulder. The space between the humeral head below the acromion becomes narrow because you have this little space and we got a bursa in there. But if it gets irritated because maybe you landed on it or you threw funny one way and it starts swelling, now it's rubbing on those bones that aren't going to move. And now that it's rubbing, it's going to swell more, and it's a vicious cycle. Also, it can happen in the tendon of the supraspinatus muscle that it comes across as well, where the bursa is, and it's a small spot. So there's a lot of little areas that things can basically get caught in. And there's pain typically with abduction and external rotation. The pain is described as like deep, like it's inside, like you can't get to it. And most of the time it's a burning pain, strength loss. They're just like unable to do things. Bicep tendon injuries. So remember, we have got our long head and our short head of our bicep. Most oftenly it's in our long head, and it become compressed within that subacromial space. That's also another type of impingement. You can also have a tendinitis because of this, because obviously it's a tendon and it's irritated tendinitis. So when the tendon becomes inflamed, it's less stable in that little groove, and so it flips out of that groove almost, and with the violent force of flipping in and out, you're still irritating it, and once again, we're in this vicious cycle. So you can actually sublux the long head of the tendon of the bicep in and out of the groove. Pain is a huge sign of this in abduction of the shoulder joint and with supination of the forearm against resistance. And sometimes you can even get a snapping or popping sensation. And you can also palpate it. When you palpate the front of your shoulder, you can find your bicipital groove pretty easily, and it's painful. Like, it doesn't feel good, no matter if you have a problem or not, but you can almost feel that little spot, and that's how you can tell if that's irritated or not based on their pain and complaints. So, what's the difference between tendinitis and bursitis? Honestly, feeling for the patient, very similar, very common. Okay? Tendinitis, it's an inflammation in the tendon. Bursitis, it's an inflammation of the bursa. Remember, we have bursa sacs all over to help allow our joints to move properly. But if our bursa sac becomes impinged or inflamed, it's going to push on the tendon. Most oftenly, both of these are caused by overuse injuries or repeated compression from the bursitis, or repeated trauma for the tendinitis. Common locations for the bursa, it's the subdeltoid bursa or the subacromial bursa, or for locations for the tendinitis is the supraspinatus and the biceps long head. Treatment is the same. Cryotherapy, anti-inflammatories, limit activities, correct their throwing patterns, and strengthen everything else around it. Because if everything else is stronger around it, it will help support that area. Then we got contusions or shoulder pointers, just like a hip pointer, okay? Just a bruise, okay? And it can be pretty massive and pretty violent simply because of the location of the shoulder. Brachial plexus injury. We've talked about this before in regards to the neck. Same thing, stinger, okay? It's the bundle of nerves that innervate throughout the cervical spine and come out. And it's from typically excessive stretching, that tackle that you overstretched. And signs and symptoms are burning, radiating pain, numbness, and loss of function. So you got to just let it have time to repair. Now there's labral injuries. So when we talked about the shoulder, remember we talked about the labrum, basically the shoulder's version of the meniscus. It makes it a deeper cup, it holds it together, it helps with structure of the shoulder, helps prevent dislocation. However, it's cartilage, so it can tear. Most commonly, it's a slap tear, and that's the superior labrum, anterior and posterior tear. So it's at the top. When you talk about tears, they talk about it in a clockwise fashion. Okay, so it's at the top, anterior to posterior. There's pain and clicking. Bankark's lesion is an inferior labral tear, so it's a lower on the bottom, like a 6 o'clock area. And the signs and symptoms are very similar. It's just you honestly find out with MRI. That's how you know what these injuries are. So those are the most common injuries for the shoulder.